All right, this video is going to be about EKG. So first off, starting with what EKG is. Some of you may have already taken an EKG course. This might be the first exposure to EKG for some of you, but here's just a little bit of contextual information to help you understand what you learn in the lab. So EKG, very simply broken down, is electrocardiogram or electrical heart image. So really just it's a way to visualize the electrical activity of the heart, and by doing that, we can kind of identify issues or potential risks of that patient by visualizing what's happening with their heart function. So by using EKG, we can detect heart abnormalities, assess the heart's reaction to stress or exercise, and examine exercise or cardiovascular health risk. So the way that this is done is kind of two different methods where EKG is most commonly used. First is for a resting test. So this is where the individual lies down and they don't move, and it's a way to determine if there's any abnormalities when there's very little stress on the heart at the time. So the heart's in a resting state, it's not working very hard, it's not fighting against gravity to pump the blood around the body. So if an abnormality shows up here, we know that it would likely show up with stress as well. So this is kind of a preliminary measure to determine if there's any abnormalities that the clinician or the individual should be aware of. Usually this is done if there's a family history of heart disease or heart abnormalities that need to be screened for, or if the participant or patient is having any chest pains or concerns related to their heart at rest, then a resting test would be done. For a stress test, this is a little different where the patient is actually doing an exercise. So generally this is on a treadmill, it can be done on a bike or whatever is pertinent to that patient and their concerns or the doctor's concerns. So this is done to put a stressor on the heart, where some abnormalities show up at rest, some won't show up unless the heart is working harder and is in a stressed state. So abnormalities might show up during this exercise test, and that tells the clinician something different than if it shows up at rest. So the way that an EKG works is generally using a 12-lead EKG. This is what we'll be prepping in class and is what most commonly is used in clinical environments. So the 12-lead EKG actually has 10 electrodes. I'll get into what 12-lead means in just a moment. The 10 electrodes are placed on these locations for a stress test. For a resting test, the right arm, left arm, right leg, left leg would be placed actually on the limbs, so on the wrists and the ankles, but that would be unsafe for a stress test where the participant is moving. So for a stress test, they're placed in these locations. And these locations are very precise for a reason. So it's called a 12-lead EKG because we get 12 views of the heart. So you can think of each view as kind of a camera looking at that different angle. So the different angles are looking through different leads. So if V6 is looking towards the right arm, we get this view of the heart. And by getting these different angles and perspectives of the heart, we can better understand where abnormalities might be and assess the severity of different abnormalities. So it's 12 lead using 10 electrodes to get 12 views of the heart. In those views, give you different perspectives where waves are different heights, different directions based on the direction you're looking at the heart, but you would recognize this kind of classic QRS complex from an EKG where you have the P wave, the QRS complex, and then the T wave. Different segments and different intervals tell you different things about abnormalities of the heart. So that's just a general overview of EKG and why it might be used in a clinical setting, just to apply your knowledge that you learn in the lab on these different skills days.